Hi, thank you for joining the live. I'm just sending the invite out to as many people to let them know that we are live. Hope everyone is well. Still getting used to this TikTok live thing. Okay, I think that's enough. Hi. So we're going to be talking about breast examination and gynae cancers today. I've got a presentation that I made, and hi Dom. So going to just go through the presentation. I know that it may be a little bit medical heavy, but there's no other way around it. So if you do have any questions while you're watching the live, just put the questions in the chat and I will try and explain it further. Oh, Zayden, Assalamu alaikum. Thank you so much. I'm going to do this presentation. Hopefully you'll enjoy it and you'll learn a lot. And the most important thing, guys, is everybody got their coffee ready. I've got my coffee. I know it's quite late to have coffee, but I've got work to do afterwards as well. Assalamu alaikum, Imani events. So I'm going to wait a little bit until we get a few more people on the live so that we can start the presentation. If you can share the live, guys, and tap to like the live, the more people who will be able to benefit from the information today. Thank you for the follows, Aiden. Assalamu alaikum, Baijan. How are you, Imani events? Dr. K, thank you for the gift, although I do not want gifts. I just want you to share the live and increase the knowledge of the population about breast cancer and gynae cancers. So just waiting on a few more people. Oh, I don't know. What gift? Hi, April. Thank you, Dom, for sharing the live. Let's just wait till we get a few more people in and then we're going to start the presentation. So what do people know about breast cancer and how to examine and gynae cancers as well? It's going to be interesting to go through some of the symptoms that could indicate these cancers. Okay. As you know, cancers are getting more and more common now, and it's scary, really, how many people we diagnose and have to go and undergo treatment. Assalamu alaikum, Zainab. Hi, user 796. Assalamu alaikum, Khatim. Assalamu alaikum, user 796 again. Oh, you like the live. Thank you. Hi, Maya. Alhamdulillah, I'm good, Zainab. How are you? We have the best name, you know. Right. Share the live, guys, and let's see how many people we can get on the live to learn about breast examination and signs and symptoms of gynae cancers. Yeah, we are named twins. That is right. How was everyone's day? And actually, I do want to know, where is everybody joining from? Is it just the UK, or are we looking at across the world? Or I'm from the UK. Hi, Caroline. London. Very nice. Rashi's joined as well. Thank you so much. Right. UK, London. Very nice. Blackburn. This is amazing. Yeah, Caroline, I had a good day. The Upside Down, very nice. Come on, Stranger Things is the best, honestly, guys. If you haven't seen Stranger Things, I don't get paid promotion for promoting it, but I'm obsessed. Okay, so Birmingham, very nice, user 796. Yeah, Caroline, I had a normal clinic today, morning and afternoon. Oh, alhamdulillah, you're in remission. Oxo, walaikum assalam. I'm sorry to hear that, though. I mean, good that you're in remission. That's amazing. But it must have been quite an ordeal to go through. Hi, M Teddy from Ireland. Where are you from, user 637? Northeast London. Very nice. Thank you for liking the live. I really appreciate it. Okay, shall we start? Have you shared? Because you don't want to miss the information. Let's just put it that way. Okay. Right. So I'm going to turn flip the camera around to show you my presentation. Okay. So let's have a look. This is a presentation I have done to people who are not medical. Okay. So we went through breast examination and signs and symptoms of gynecological cancers. Now, listen, I need to let you guys know that if you do not understand what I'm saying, because you have to remember, I speak medical all the time, just write in the comments if you don't understand what a word or whatever, and I will go back to it. Okay. So firstly, we're going to talk about how you're meant to examine your breasts and what the red flags are in terms of breast symptoms. And then we're going to talk about the breast screening program. We're also going to look at red flags when it comes to gynae cancers. And then we're going to have a quick chat about the cervical screening cancer program. And then you can ask me questions. But you can ask questions as we're doing this anyway. So I'll keep an eye on the chat. All right. So when it comes to breast cancer, guys, can you believe that 1 in 7 women are diagnosed with breast cancer in their lifetime? Okay. And if you have a look at the demographics across the UK, you're looking at, in the UK, 55,000 women are diagnosed each year. That's shocking. Okay. And in terms of deaths each year, you've got obviously more females than males. But that is still 1 every 45 minutes. But across the middle, you can see here the rate of survival is increasing. And can anyone write in the chat why survival rates are increasing? Why are survival rates increasing from breast cancer? Thank you for joining the live All Things Home. Why do you think breast cancer survival is increasing over the last 10 years? Assalamu alaikum, Dr. Casanova. Being aware and educated, absolutely. But also, Maya, it's about treatment. The chemotherapy treatments, the surgical treatments are, improving day by day. So this is the reason why breast cancer survival rates are increasing. So 8 out of 10 breast cancers occur in women over 50, which is why, yes, Dr. Casanova, the screening programs target those women who are over the age of 50. Absolutely, Dr. Casanova. And 10,000 women under the age of 50 are diagnosed with breast cancer. And 3/4 of those will be in their 40s. Okay, that's an interesting set of facts. Any questions before I go on to the next slide? Thank you for joining the live. Please like and share the live, guys. So we're looking at breast self-examination. Okay, so this is a slide that was done to help women understand how to examine their breasts. Now, it's really important that you examine your breasts regularly because you have to get to know what's normal for you. And only then will you realise what is different. I have known women who have just randomly checked in the shower or if they've felt a bit of pain and then they've noticed a lump. If they had examined regularly, maybe they'll be able to pick up the lump a little bit earlier. So the best way to do it is always have your arm up beside your head like that. And then you can actually, that stretches the muscles of the chest wall. And then you'll be able to feel the lumps. Okay, any lumps or any changes. And one of the things that we always say to be breast aware, okay, so the red flags when it comes to breast symptoms are if you feel a lump, if there is any nipple discharge, if there is any dimpling of the breast, if, for example, you have any breast pain that's not in keeping with your cycle, if the nipple is actually retracted or inverted, because that could indicate that a tumour is pulling that nipple in, that can be a sign of breast cancer as well. Interestingly, if you have eczema of the breast or redness or skin changes of the breast, that can also indicate breast cancer. One of the things that people don't know is that if you have a lump in your underarm, so in your axilla, so right in the underarm, that could also indicate that something is going on in that breast to cause that lump in the underarm, which would be a lymph node, to swell. And also if you have breast swelling as well. So please look out for any symptoms like that. Examine your breasts regularly. And thank you for joining, Mr. Fox. So yeah, this is really important, guys. Any questions before I move on to the next slide? No questions. So how do we, what is breast screening initially? Let's have a look. So I spoke about this last week, and I know some of you already know what breast screening is. So all women between the ages of 50 and 70 will be screened every 3 years, and your results will be ready within 2 weeks. So this is a picture, because some of you didn't know, it's gone up, sorry. Some of you didn't know what the actual X-ray machine looked like. So the mammogram is essentially an X-ray, and they take 2 X-rays of the left breast and 2 X-rays of the right breast. And the reason why they do this for women over the age of 50 is because the breasts are less dense. Less than 50, the breasts are too dense, so then they can't pick up any evidence of cancer in women of that age. So so it will be women over the age of 50, and they will have this mammogram. So they essentially just X-ray. 2 X-rays of the breast. Let's have a look. Someone's commented here, all the people who've had treatment with me, we were under 40. You know what? It's true. In terms of I do agree with you that, I've seen a lot of women who have had breast cancer under the age of 50. However, the mammogram does not really pick up cancers in women under that age, which is why they've targeted them age 50 and over, because the breast is too dense. Now, if you're aged under 50 and you have symptoms, then you should go to the GP anyways. Or if you have a family history of breast cancer, see your GP in case you need screening or some sort of investigation done earlier. So please attend screening. If you know of anybody, your mum or your grandmum who may be in the same age group as those who need to go for screening, please share this information to them. So second time the scan, missed my cancer in another breast. Once again, I found another lump in myself. I'm really sorry, Oxo, that you've been through so much with this. Okay, right. Any questions? Surely, you can do ultrasound scan under 40, but then the X-ray is not for under 50s. Unfortunately, the screening only targets those who are over the age of 50. Okay. So thank you so much for everyone joining the live and liking the live. I think it's really important that we make everybody breast aware, whether you're a man or a woman. As you can see, men can also get breast cancer as well, especially if there is a history of breast cancer in their family. And I know, you know what, I do think it is something that people are sometimes embarrassed to talk about. But as a doctor, as a GP, I have seen women's lives change when the diagnosis happens, but also when they're having the treatment. And when they are, cancer-free, it's a wonderful feeling that they've been treated and they're now cancer-free. It's amazing. So breast cancer screening, I know of quite a few people who've had breast cancer screening, and that's picked up a cancer. How have we gone from 1/8 to 1/7 to 1/8? Was it UK or worldwide? That one was the worldwide one. 3 days without water dissolve. I'm not quite sure about that, Nave. Thank you for joining the live. Okay, right. Let's go on to gynaecological cancers. You know what? You guys might find that some of the terminology may be a little bit too, let's have a look, a bit too much medical. If it is, just please let me know. So when it comes to gynaecological cancers, does anybody know about endometrial cancers at all? Please, doctor, tell me my hands and feet are numb every time. I'm sorry, Eamon, we're just doing a live on gynaecological cancers and red flags. So, endometrial cancer signs. So if you are under the age of 50, and you haven't had a period for 2 years, okay, and then suddenly you have a bleed, exactly, Dr. Casanova, that could be a sign of endometrial cancer. So this is the womb, okay, and that's the endometrial lining. And endometrial cancer is basically cancer of the lining of the womb. Okay, so post-menopausal bleeding, essentially what that means is after you haven't had a period for a certain length of time, suddenly you have a period and it's not normal for you. That would be classed as a red flag. Your GP will refer you for investigations. Okay, do you know what? Mitch, do you want to join me live? Mitch is a GP as well. Let me know. Okay, so symptoms are bloody or watery discharge, discomfort or pain in your tummy, difficulty when you go into the toilet, pain during intercourse, and bleeding between periods or after the menopause. So some women can have endometrial cancer even when they haven't gone past the menopause, because that it can happen to anybody at any age, but it's a change in the period. If a woman has normally has sort of normal periods and not that heavy, and suddenly they're really, really heavy, I would do an ultrasound scan and double check that it's not endometrial cancer going on. No, if you miss a period more than 2 months and not pregnant, I mean, that could be related to hormone changes, stress as well. So vulval cancers, okay, so this is another issue that comes up in general practice. So you're thinking about any changes around the skin of the vulva, so burning, pain when passing urine, a mole, because people can get melanomas on their vulvas as well. If there's any bleeding or discharge between periods, if you've had any lump or wart-like growths, or if there's thickened skin, okay? It's really important that you get the GP to have a look, examine, and then refer. Oh, okay. Gonna go take care, everyone. When you've done all the tests and come back normal, so you're going to have prolonged periods. I mean, maybe you need to go on the pill, Amina. Sometimes that can help. Okay. So this is another one, vaginal cancers. So again, you're looking at blood-stained discharge, pain after intercourse, pain in the pelvic area, lump in the vagina, difficulty when going to the toilet, blood when passing urine, and actually pain in the back passage as well. So that is really important. If you have any of these symptoms, then you should see your GP. Okay. This is the one that really scares me, guys. This one, because this is really a silent cancer. Okay. Ovarian cancer presents so late in a lot of people because the symptoms are really vague. Obviously, these symptoms can be attributed to other things as well. So, for example, if you've got fatigue or indigestion, weight loss, appetite loss, it could be something to do with your bowels or inflammation or you're not absorbing things very well. But it can also mean ovarian cancer. Okay, so let's go through those symptoms. So common symptoms are feeling full quickly after eating, pain in your tummy or in the pelvic area, bloating, and you're going to the toilet more often. Okay, and the other symptoms are fatigue, indigestion, weight loss, appetite loss, back pain, tummy swelling, if you've had changes in your periods or irregular bleeding, and pain during intercourse. Now, this cancer presents usually terminal because of the way that it presents. People ignore the symptoms and they present really, really late. So I mean, I don't know how else they can actually improve the diagnosis of this cancer. We do a blood test called CA125, and if someone comes in with pelvic pain, usually do that blood test, and then if it comes back as raised, so CA125 blood test, then we can actually investigate further, maybe do an ultrasound scan or a CT scan to find out if anything's going on in that pelvic area. Yeah, London B, CA125, absolutely. Okay. I hope you're finding this useful. Has anybody got any questions so far? Yeah, Dr. Leo, it is. I have the same symptoms for months before, but it is negative. Okay, that's fine. That's really good to hear. I mean, yeah, sometimes you can have these symptoms. Like I said, they're very vague. Anybody can have these symptoms at any point, but it's like collectively, if you go to your GP and they say you have all these symptoms, they may do these blood tests and actually do the referral for the ultrasound scan. Is there a jab? I don't think there is. I think mine is related to hormones as to what they ruled out. They said it's fibroids and gave off progesterone. Okay. Yeah, because sometimes fibroids can cause abdominal swelling, pain, heavy periods as well. So these symptoms can be attributed, like I said, to other things. So cervical cancer, I'm going to be doing a separate live on this one because cervical screening is not that good in terms of uptake, especially amongst Asian population. And I do feel that it maybe is because it's an uncomfortable examination. It's a bit more of an intimate examination or screening program. But I think, it can save your life. I know women who have had the screening where they've taken cells from the cervix and they've had, cervical cancer picked up or changes picked up, and they've been treated and cured. So yeah, pain in between periods or after intercourse, pain during intercourse as well, longer or heavy periods than usual, unusual discharge, and bleeding after menopause as well. So if you present to your GP with bleeding after menopause, they will do an examination and check your cervix as well. So cervical screening, okay, is done from the age of 25 years and above in England. So between the ages of 25 and 50, cervical screening is every 3 years, and between 50 and 64 is every 5 years. Okay, so until 6, and you can opt in to have screening later on, but usually the chances that you'll have cervical cancer after that, the incidence drop. Yeah, this is cervical screening. So cervical screening for between 25 and 50 years of age is every 3 years, and between the ages of 50 and 64 is every 5 years. Okay, so that's really important. Does the smear test for cervical and previous cancer you mentioned? No, it doesn't test for the ovarian cancer. The speculum examination, which is where they put a plastic instrument into the vagina to look at the cervix. They take a few cells. That's cervical screening. Ovarian doesn't have a screening program. I know I say cervical or cervical. People say it differently. Okay. Right, guys, I'm going to turn the screen around now, because sometimes what TikTok does, if it sees that I have not been active in terms of my face, it decides to lock me out for a little bit. It says, So did you find that useful? That's what I want to know. Yes, Sarah, you can ask a question. Thank you for joining the live. Are you a doctor? Yes. So, great. Any questions about the red flags when it comes to breast cancer and cervical and gynae cancers? Thank you so much. You'd like to ask about bladder. Jasmine, you know what? I am going to be doing something on prostate and bladder cancer in another live. Thank you so much, Dom. What is the time anyway? It's 10 o'clock. Not bad, not bad. If you want to follow me to find out about more lives that we're going to be doing about cancers and things, I know some people it's a trigger topic, but I do think it's a very important topic. We can do other things as well. I was thinking about doing mental health. I think I see a lot of mental health in my practice, and how we can help people. So yeah, you should do the screening. I know it's a bit awkward, and we've all been there. Endometriosis. Yes, I will do a live on endometriosis at some point. Or what I'll do is I'll probably do a video on endometriosis. But Dr. Abdul, he's on the live. He has many videos as well, and he's done one on endometriosis. I enjoyed watching that one. So please, everybody, follow Dr. Abdul, Life of a GP. Okay. Sorry. So yeah, thank you so much for the follow. So what we'll do is, if you guys have any questions regarding screening, breast cancer screening, cervical screening, please ask the question now. I hope that it has been useful. Let me just see. Does anybody want to join for questions? Just a question and answer for a few minutes, and then we'll leave, just to add a bit of interaction here. Dr. Abdul, would you like to join the live? Or are you putting the baby to sleep? Yes, you need to do all the screenings offered. On the NHS website, there is a timeline. There's actual timeline. I think I've got a video on it where it goes through all the screening programs that are available for everybody and what age it's available. I would go on that and have a look. What screening programs? Usually cervical screening, you will get a letter in the post about booking in, because the screening program is not, although the GP surgery does it, it's actually a separate program that's done by the government. And, that's how it's done. So usually you'll get a letter in the post for cervical screening. Breast cancer as well will come through the post. Oh, did you miss the vulval cancer screening? Oh, vulval cancer. Okay, fine. I will do that for you. No problem. So let's have a look. I think it was the slide before that. So vulval cancer symptoms. So as you can see here, so This says, know your vulva, know your normal. That's really good. So persistent itch, raised or thickened patches of skin that can be red, white or dark, a lump or wart-like growth, a mole, which is a skin change on the vulva that looks kind of dark, that changes shape or colour, pain, soreness or tenderness, bleeding from the vulva or blood-stained discharge between periods, an open sore or ulcer, and a burning pain when passing urine. You know, I'll say one thing. I had a patient very recently who came in that felt that she might have some sort of lump, but when I had a look, the vulva had quite a big sore there, and I think that's what was causing the issue. So I did a 2-week wait referral straight away. Sorry, Sarah, what was your question? Sorry, can you ask again, please? Can I have a smear? Okay, just ask again, because you know what? I'm focusing on the slide as well, and looking at the questions. I don't want to miss your question. Kindly respond to it, yes or no. What was the actual question? Just ask again. Thank you. Thank you for the follow. So let's go back to... This one is a really important slide, guys. This one. Ovarian cancer. Oh, walaikum assalam, Muslim women issues. So you can see here the vague symptoms. No, I don't think the vulval varicosities can cause cancer. No, Humera. Not that I'm aware. If someone has a hysterectomy, tubes and all removed, still screening. So if you've had a hysterectomy, where your cervix was also removed, because in some hysterectomy operations, they keep the cervix there. But if your cervix has been removed as well, then no, you don't need cervical screening because you don't have a cervix. Endometriosis doesn't cause cancer, but it can cause other symptoms, such as really heavy periods, because endometriosis is where you've got endometrial tissue, or the lining of your womb is in other areas of your body, unfortunately. Lichen sclerosis. As far as I'm aware, there can be a slight increased risk with that. So I have pain in the pelvic area, back pain, and sometimes... Okay, 2 seconds. Let me just flip the camera around again so I can actually interact a little bit. You'll have to speak to the clinic that does the embryo transfer. It depends on where the adenomyosis is. It depends on where it is in the uterus. Okay. You may have to go, Yasmin, to the GP to get an ultrasound scan for that. Okay. Thank you for doing the live, guys. It's really interesting to see people who want to know about women's health and who are passionate about it. I hope you are. Because as a woman GP, I see obviously a lot of female patients, and I really want people to be aware about what is normal. Is nothing to be embarrassed about at all. We need to know what's normal for us and know our bodies, so that we can go to the GP in time. Yeah, but also, Lindsay, you know what I've noticed is a lot of the Asian population that I work with, the screening uptake is so low because there's not the knowledge. There's that feeling of maybe embarrassment, but maybe that's the case in all cultures and things. And if we make it less of a taboo to talk about these things, I think it will make people more likely to attend screening. And I've found also that a lot of the Asian population, they present with breast cancer quite late and end up being really quite unwell, and the stages of the cancer is quite advanced. Okay, Sarah, you're very well. I mean, I answered your question with the one that you asked. That's not a problem at all. Okay. So, do ultrasound scans detect local cancers? They can do. Depends on where you're ultrasounding. Okay. Why do GPs always mention, do you have anxiety? Do they say that so they can veto you out? I don't know. I don't say that, so I don't know. Yeah, I wouldn't engage in that, Dr. K. Is there pain relief for cervical screening? Do you know, it's not that painful. It's uncomfortable, but it's a few seconds. It shouldn't be painful. I think it's just because of the way it's quite an invasive, it feels like it's an invasive screening program. They're putting a speculum in and they're opening it up and they're, brushing the cervix surface. I don't think that it should be painful. Oh, you're very welcome, Mesbani Kitchen. I have endo and adenomyosis. Oh, I'm sorry to hear that, Crispy Delights. Yeah, exactly. I think it's just about taking deep breaths and just relaxing, okay? The nurses are really experienced. Yeah, the smear test that is the screening program. So is it normal to have severe fluid discharge after periods? Yeah, it can be normal to have some discharge after your period. It depends on how much discharge you're getting. Could it be an infection? No, they don't cut you. I don't think that's true. Sometimes they might position you a little bit different. They might ask you to put your fist under your back to try and position yourself in a way so the cervix is more visible. But you have to remember these guys. Hi, I'm good, thank you. How are you? You have to remember that they're very experienced. They examine a lot of women, so they'll know what kind of position will help them to visualize the cervix. Okay. Had scan, nothing wrong. So I've never ended menstrual cycle for 3 months with clots. Had scan, nothing wrong. I mean, dysfunctional uterine bleeding is something that can be quite common, and it's in women who maybe there is a bit of stress there, because you have to remember if you stress or you're worried about something, it can affect the hormone. I'm going to talk all medical now, but it can affect the way that the hormones are released, and so it can affect your cycle. Sorry, there's so many comments coming through. How would you? Do you know FGM? I think that's a difficult one. It would depend on what the stage of FGM is. It is a bit it is uncomfortable, but you know what? You'd rather be a little bit uncomfortable than have cervical cancer and ignore it, because if cervical cancer is there and it's advanced, it's life threatening. Any advice to struggle with period pain? Yeah, we've all been there, isn't it? So it's any advice. So just painkillers, ibuprofen, paracetamol, hot water bottle, or if you want to go on the pill, that's also a option as well to help minimize the pain and the bleeding. But Cora, I would definitely get a swab done. Assalamu alaikum, wa alaikum assalam. Right, guys. I just want to see whether... 2 seconds. Dr. Abdul. Oh no, maybe he doesn't want to join. Does anybody want to join as a little guest for 5-10 minutes? And then please, can you answer my question? What was your question, Kanza? I didn't see. Yeah, you're right, Maura. The risk is not worth it. Absolutely. Oh, guest. Oh, I've got a guest. Oh, accept. Okay, guys, just wait. Hang on a second. Assalamu alaikum, Dr. K.
Alaikum assalam.
Can you hear me? Can you hear me, Dr. K?
I can hear you. Can you hear me?
Yeah, I can hear you. How are you?
Yeah, good. Just to say kudos for doing this difficult topic, especially. I don't think. I mean, I can see the comments and questions coming here thick and fast. It's difficult to keep up. I don't think you're doing it deliberately. I wouldn't be able to answer all the questions as quickly as you could. I think there was one important question from a medical point of view that I think you glanced over as well. It's probably because it got lost in the comments coming in. Everyone giving salam, which is nice, but I think if people stuck to the topic, it's more beneficial for people listening.
Yeah.
One of the questions somebody asked was that if a woman has a IUD fitted or a coil which is there to prevent menstrual bleeding,
Yeah.
aren't they running the risk of masking red flag symptoms? And how can they be reassured, I guess, that they're not missing a potential cancer when they're in that age group?
Yeah. So what age group are we looking at then? Just any age group that could have.
I guess if you just went through, because I guess most women would be in their 30s, 40s, and 50s that did that.
I mean, that is a difficult one, because if, for example, somebody has the coil, and if they've got endometrial cancer, for example, then that coil won't affect it, the bleeding will still happen. They'll suddenly get heavy bleeding, and then in that case, I would do a ultrasound scan on a 2-week wait, because the coil essentially should be thinning the lining of the womb, and if you've got a cancer there, it will override that progesterone in that coil, if you see what I mean. If somebody is concerned that they've got some bloating and things, they're thinking, actually, could it be ovarian cancer, which is not like endometrial cancer? I would just see the GP. If you're getting bloating and other symptoms, then we would just do CA125 and we would do an ultrasound scan along with it. And someone's asking here, are early fibroids a risk of ovarian cancer? Not really, no, because fibroids are generally on the uterus, not on the ovaries. And let me just have a look. There's so many questions coming through. If I haven't answered your question, then please could you just re-type it in the chat. And Ruki's asking if she wants to ask you something privately. That's absolutely fine if you wanted to. That's not a problem. Anyone who's having any abnormal watery discharge, I would see the GP, because quite a few of those comments are coming through, and get a swab done. What is PIRAD 4, please? Can you tell me about PIRAD 4? I don't know about that. So Bakura's 24 has mentioned watery. I would get a swab done to check it's not an infection. Small ovaries, I don't think that means anything, really. Ovaries are ovaries. Hi. So, what are your thoughts on the things that we mentioned on the live, Dr. K, the presentation and things? Do you have any questions about it?
No, I think that was it. I think it's difficult because you've just got such a wide target audience where you don't know what someone's background is, whether they may not necessarily be medics, they could be pharmacists, nurses, etc. We don't know what their level of background is. Comparing that to somebody who's non-medical, who may be working in the finance industry, who hasn't got a clue what you're talking about. When you mention terms like post-menstrual bleed, if you just pull someone from the bus stop. So I think it's good in terms of creating awareness. I think you did touch upon the important point, especially amongst ethnic minorities, where there is this reluctance for, as someone was mentioning, whether it's a cultural thing, etc. We don't know. I'm sure that's got a part to play, but there is this big taboo of females approaching. And I don't think it's a male thing. I think whether it's approaching male doctors or female doctors, I think there's a big taboo of that. They keep this part of their life very, very private, and so these communities stay very insulated, and therefore I think there is a low uptake in screening communities. And I think we just have to get that health promotion out there to try and increase screening and create awareness. So I think lives like this are very good from that point of view. And if it gets people talking, then great. We're not expecting people to leave here and give a lecture on gynaecological and breast cancer, but if it creates awareness amongst them and the questions and the sort of red flags, as you put it, to look out for them, that's great.
Yeah, thank you so much, Dr. K. I mean, when you put it like that, it's kind of reassured me that I'm doing something that's going to benefit others. For me, it is about raising awareness. It is about giving people food for thought about their own health and the health of the people that they live with. Or I know that a lot of people are asking questions, and it's lovely that they're asking questions. We have to stick to the topic, but it's just difficult when there's 82, nearly 100 people were on the live and all typing in their questions, and I'm trying my best to answer. But like I said, one of the cancers I'm really passionate about trying to diagnose early is ovarian cancer. The symptoms are so vague that people ignore them, and that's the danger, really. So it's really important to give them people the knowledge about that. Ismir, I've never got this done. Absolutely, Noura. If you're 25 and above years of age, you should be undergoing your screening if you live in the UK. I'm sorry about that. Yeah, Dom. So it's thank you so much, Dom. So it's really important to attend screening. It's free. It's free screening, and you're over 40, you need to go for your screening, 100%. Contact your GP. They will have you as outstanding as the cervical screening. So all you got to do is book in with your GP, book in for cervical screening. They'll send it off, and you'll be re-put on the program. Yes, I would say you should, even if you're not active. Okay, if you're not sexually active, I would still actually go for screening. Let's have a look. Any more questions?
Just on that point then, with regards to I know why they asked that question, and just to explain it to all the other audience, that people say cervical cancer, the biggest cause, it's not the only cause, but the biggest cause is the HPV virus, the human papillomavirus, type
Yes.
16 and 18, which is sexually transmitted. And
Yeah.
so a valid question amongst a lot of people, and if you just explain the logic behind that, so a valid question amongst lots of people is, if someone isn't sexually active
Yeah.
or hasn't been sexually active, let's say this is a 16, 17-year-old girl who's not sexually active, why should she be getting or be concerned about cervical screening?
I mean, yeah, HPV, you're absolutely right. HPV is seen as the biggest risk factor, but it's not the only thing. Do you know what I mean? So you could still have HPV negative, be HPV negative, and have changes on your cervix. But yeah, you're right. When it comes to cervical screening, oh, that's amazing that you're going to. Oh no, you need to go. You need to go for your screening. So HPV, if they find that you've got HPV on your cervical smear, then you will be straight sent to colposcopy, which is a further investigation that they do. If you
Can you just explain to people what colposcopy is? Because
Okay,
again,
so
there's a big word that they may not understand.
Thank you, Dr. K. So HPV is human papillomavirus. So it's a virus that is seen to be causes an increased risk of cervical cancer. Let me just see if I can find that slide. 2 seconds. I do have a slide on human papillomavirus. Can you see that? So, human papillomavirus, okay, guys, is a common group. Well, HPV is part of a group of viruses. Usually doesn't cause a problem, okay, but it can present as with warts. And like I said, it's associated with cervical cancer. Most people do not have symptoms, all right? As we know, cervical screening checks for this. And I don't know if you guys know about the vaccination program, but those between the ages of 12 and 13 at school, they will receive the vaccination for this. Okay. And it is sexually transmitted, as you said, Dr. K. There is no blood test for it, but it's not just cervical cancer or cervical cancer, other cancers, which are anal, penile, vulval, vaginal, and some types of head and neck cancers as well. Okay, so this is that virus. They look for that. If they see that you have HPV on your sample, they'll send you straight away for further investigations. Now, I don't think it's going to be on here actually. So what I'll do is 2 seconds. Let me just switch back. So what is colposcopy? You asked me that question. So colposcopy, which is what that further investigation is where they basically is a bit like a cervical smear, but it's a bit of a longer examination. So they have a closer look at the cervix, almost like a magnifying glass on the cervix, and they have it on a TV. They show you, and they basically look for any cells that look maybe abnormal, and they will then remove those cells in real time in that examination. Okay, so basically it's a cervical smear, but a little bit of a longer procedure. But it's to remove the cells that have shown HPV. And then if you've had HPV, then they will recall you a year later. So until you are clear from the virus. Okay. I know, but I think even if you're not, I guess, the thing is when it comes to if you're not sexually active, and they do have speculums which are for people, women who haven't had intercourse, and they will be able to use those. I guess it depends on its personal choice, really. I would say you should go for screening. I didn't have the vaccine. It only came out while I was training as a GP, and they offer it to every boy. It used to be just girls, but then they started offering to boys as well. Moody Muslim, you didn't have it. Well, I think it's a hard one, isn't it? You didn't have it. Am I okay? Of course you're okay. From where does this virus come from? It's just like how COVID is. It's just there, but it's a sexually transmitted infection, and unfortunately, there are people who have that virus. And if someone was to have intercourse with them, they would get that virus. Please, can you respond? Sorry, SR123. I am really trying hard to answer questions. Yeah, I think Muslim women issues. He's asking about the HPV one. I wanted to get the vaccine, but I wasn't allowed to have it. Why not?
And I think that this goes back to that point. There is this taboo where, if your kid was sent a
Yeah.
letter home from school saying they're going to have this and explaining why they're going to have it. They mentioned the HPV virus and sexually active and cervical screening. I mean, certainly my generation, I growing up in the 80s and 90s, your parents wouldn't even allow you to go to SE lessons, let alone taking a vaccine for HPV. So I think there is that reluctance because, again, that taboo and cultural barrier kicks in.
Yeah.
And so and parents do have a choice, of course. But it's important to realize the reason behind the vaccine.
Yeah, exactly. And I think, you know what it is? It's a bit like the other vaccines as well. People don't want to have it because they're scared of like autism and, you know, the MMR. It just spreads that kind of the rumors about it. But my view is just get it done. I mean, the risks of getting cervical cancer with HPV, if you're vaccinated against HPV, that's a huge thing. We're still seeing some of the benefits of the vaccine coming through with the girls and boys that have had it done. I agree, it's misinformation. You can catch it from saunas or gyms. Oh wow, oh, wow, Maura.
I think that's like saying you can get pregnant from a toilet seat, to be honest. But anyway, there was a good question asked about someone said, "Can you explain the relevance of C1N1 cells?" Which I think is quite important.
Yeah, let me have a look. So when they say CIN1 and things, that's basically, it's not saying that that's a cancer, it's just a change in the cell. So the cell has changed, which could be going towards a cancerous cell, or sometimes what can happen is it can go back to normal. Cervical cells change back and forth, and your cervix is one of the areas of your body that regrows. Believe it or not, so it's one of the things I would say is not to worry too much about that. Is that you may be recalled for screening earlier to check that either the cells have gone back to normal or to check that they haven't gone the other way. Thank you so much, Muslim Women Issues. Thank you for everyone who is joining the live. Thank you for liking the live and sharing the live. I really appreciate it. So, any other comments, Dr. K, to keep this going for a few minutes?
No, I think at a layman's level, and
Yeah.
speaking as a non-expert in women's health issues, I don't think there's anything I'd like to
Thank you so much.
add to that. I think related to this, I think is an important offshoot because when you mention, it's important for me also to stress that not every sexually transmitted disease can cause cancers. I think HPV is one of the few that can, and someone also mentioned lichen sclerosis, which has been linked to the case as well. But that isn't to say that STDs can't cause a whole host of other problems, and maybe there should be a separate live on there while we're talking about breaking taboo, etc.
Yeah.
You don't have to be unmarried to have an STD. I think that's important to stress, although some questions will be raised. But there is a large part of this in the ethnic minority community where I think there is a lack of access to medical information and services because of awareness.
Yeah. What I'm trying to do, a few other GPs as well. We're trying to get people to think about breast screening and cervical screening. We're going to be holding like a sort of a day for patients to come and ask questions, and maybe having, I don't know, the consultant oncoplastic surgeon at Royal Stoke. I think we're going to try and get her on at the day to try and give that presentation she did before, and to raise awareness about breast cancer and things like that. I think it's just such a good thing that they're doing, and it's just a shame that a lot of people don't want to attend or too scared to attend. There's not enough funding for cancer awareness. I'm a health facilitator. I do agree with you. I think the NHS generally is underfunded in a lot of ways, and it's run by goodwill. We all try and go individually. We all try and go above and beyond for our patients, but I think there's only so much we can do as well. So if I see or think, oh, somebody might have a cancer, I just refer them on a 2-week wait. Yeah. Go on, Dr. K. Is Dr. K, Dr. K, well, Dr. K can answer that.
Thankfully not. No, I'm not.
He's a doctor, so he obviously knows. Cannot thank you enough for your duas. Oh, Zenat. Oh, yeah, Assalamu alaikum. You had your interview, your teacher interview. That's amazing. Congratulations. Everybody congratulate Zenat for getting her job. She had an interview and she was very nervous, but I knew she was going to get it. MashaAllah. Well done. Congratulations. So, Samira, what question was that about the symptoms? What symptoms are you talking about? What did you ask? I'm trying to find your comment. Not enough funding again. This is why I think I want to use TikTok in that way to try and tell people symptoms. I mean, I do that in my work anyways, but yeah. Oh, Zena, that's amazing. You got to keep us updated on your progress, inshallah. In fact, let me follow you. Okay. So thank you so much for joining the live. I think I may want to wrap it up now. Does anyone have any more questions regarding what we've spoken about today? Do you have any more questions, Dr. K? Oh, someone is asking to join, I think. Someone unknown. I don't know if I should accept unknown. Let me see. It might be somebody. Let's just have a look who it is. You never know. Oh, they don't want to join now. That's fine. Does anyone else want to join for 5 minutes and then I'll go? So many people here. Shall I just wrap it up then? Oh, thank you, Rashda. That's very kind.
I think so. If you're going to give a take-home message to the people on this live, so if you could summarize in the next few sentences your talk, and just if you went over the red flag symptoms, which age group, because it's important to stress that it's a bit like when I was in medical school and I got a chest infection once, and I coughed up some blood, and I straight away panicked and thought I had lung cancer. So so not everyone who has post-menstrual bleeding or even bleeding outside the normal regular menstrual period will have a cancer, but it's important to just run over those red flag symptoms again, I guess, that they should keep an eye out for.
So at the beginning of the presentation that we did, we said about breast cancer and just looking out for red flags on that. So what I'll do let me just have the slide up for the breast cancer, just to summarize quickly and say, right, guys, okay, be breast aware. So if you notice any lumps, nipple discharge, dimpling, breast or nipple pain, nipple retraction or inversion, redness, changes to the skin of the breast, lymph node, so a lump in the armpit area, and or any swelling, please see the GP. Okay, so that's number one, right? And then number two, okay, the take-home message is the fact that breast screening is for all women aged between 50 and 70, and that's every 3 years. Okay, so if you receive your invitation, please go, and it's an X-ray. Okay, and gynae cancers. So if you have any abnormal, this is what I would say as a summary. If someone has abnormally heavy periods that's not normal for them, just see the doctor, because that could indicate endometrial cancer, so cancer of the lining of that womb. Okay, and if you have not had a period for a while and you've had menopause, so your hormones have gone down and you don't have periods anymore normally, and suddenly you're having a period, that could indicate endometrial cancer as well. Okay, so we spoke about vulval cancers, so any lumps or sorenesses around the vulval area, any growths, just see the GP, okay, for examination. So vaginal cancers, like we mentioned, any lumps that you can feel or any discharge, any bleeding, please see the GP for examination. This is the one that I really want to rein home, because it's vague symptoms when it comes to ovarian cancer. So indigestion symptoms, weight loss, appetite loss, tiredness, back pain, changes in your menstrual cycle, feeling full quicker, bloating, frequently going to the toilet, definitely need to get checked out on that one. And then cervical cancer, we mentioned that. So any bleeding in between periods or after intercourse, if they're heavier than usual, and then also unusual discharge or bleeding after the menopause, when you're not meant to have bleeding. And we're going to do a menopause live, guys. Menopause live, I think that is really important. And then cervical screening, as you know, if you're 25 to 50, every 3 years. If you're 50 to 64 years old, every 5 years. Oh, no worries, Muslim Women Issues. Thank you so much for joining. And as we've said, just go over to the summary. So examine your breast regularly, attend screening if you're eligible, look out for any symptoms which could indicate a gynae cancer, attend your cervical screening, and if you're worried, just attend your GP. Is that a good summary, Dr. K?
I think it's a very good summary. I think on the ovarian cancer, the number of times even I've seen in hospital where not on my specialty, but we're treating patients and they mention abdominal bloating and swelling, and alarm bells ring. I think it is that silent killer that you have to watch out for, and you should have as they say, a high index of suspicion.
Absolutely. Oh, well, it's been lovely joining everybody and seeing everybody here. Thank you very much for commenting. If I haven't answered your questions, please don't take it personally. It's just there's so many people asking questions and each one takes a bit of time. Plus, I had to deliver some information today. But thank you so much for all your support. And no, I don't think children can get vulval cancer. Dom, I am actually leaving the live now. I've been on here for a good hour. I didn't realise that was going to be about half an hour. But yeah, okay, I'll see you guys soon. And I will do another live and we'll do menopause at some point. But I'm going to try and get a topic list together so we just stick to the topic and do it that way. Okay. Thank you for joining. I'm actually leaving now. Thank you guys. Bye.